Hey guys, Oscar here with Gastroenterology Simplified. I'm a board certified physician assistant, and today we are going to be talking about acute pancreatitis, but I want to be more specific. Alcohol-induced pancreatitis. There are different forms of acute pancreatitis, but today I want to focus more on alcohol-induced pancreatitis. I'm not sure if it is that we are currently on spring break, but I have seen more people with acute pancreatitis this week. So I want to talk about it. I want to have a discussion about acute pancreatitis, but specifically alcohol-induced pancreatitis. Before we go any further, I want you to understand that this video is for educational purposes only. If you have any questions, concerns, or any symptoms, always consult with your primary care physician or your physician assistant. So, what is alcohol-induced pancreatitis? Alcohol-induced pancreatitis is a form of acute pancreatitis or chronic pancreatitis, inflammation caused by prolonged or heavy alcohol use. So, hence, it is caused by alcohol consumption. Now, what is the pathophysiology of alcohol-induced pancreatitis? Well, alcohol increases pancreatic enzyme secretion and increases the viscosity of the pancreatic fluid. This leads to premature activation of trypsin inside of the pancreas, and this results in autodigestion, inflammation, and cellular injury to the pancreas. When you have repeated injury to the pancreas, meaning you keep drinking alcohol, the pancreas is a very sensitive organ, and this organ then develops fibrosis due to the repeated injury, and this leads to chronic pancreatitis. Usually, the typical individual that has alcohol-induced pancreatitis or acute pancreatitis due to alcohol intake, typically the person has been drinking for 4 or 5 years at least of heavy alcohol use. Now, what does heavy alcohol use means? This is dependent, but usually it's often greater than 4 or 5 drinks per day. That is considered heavy alcohol use. Some individuals may drink 2 to 3, and they may have the same result because likely their organ is more sensitive than others. Only 10% of heavy drinkers develop pancreatitis. This means that genetic and environmental play a factor. Now, how the usual patient presents to the clinic or presents to the hospital with suspected acute pancreatitis. So the clinical presentation of acute pancreatitis includes severe epigastric pain radiating towards the back, nausea, vomiting, pain worsens after eating or after drinking alcohol. Hence, the pain gets worse after eating and or drinking more alcohol. Now, someone that has acute on chronic pancreatitis, this means that they usually present with recurrent abdominal pain, steatorrhea, which is like diarrhea, due to fat malabsorption. The patient may also be experiencing weight loss, and later on in life, they will develop diabetes. How are you going to diagnose acute pancreatitis? Usually the lipase is 3 times more than the normal upper level. This is very specific. Plus or minus elevated amylase levels. A CT of the abdomen and pelvis will give you the diagnosis of acute pancreatitis. Keep this in mind. The CT will give you the suspected diagnosis and confirm the diagnosis of acute pancreatitis. It will also let you know if you have necrosis, pseudocyst, and acute on chronic pancreatitis. What is the difference right here between acute and acute on chronic? Usually the CT will show calcifications around the pancreas, and that is usually acute on chronic pancreatitis or chronic pancreatitis, because the pancreas has received so many injuries and injuries and injuries that it has developed calcifications. Now, how are you going to treat the patient? How are you going to manage this? In the acute phase, you have to start aggressive IV hydration. Prefer LR fluids. Pain control with opioids. Early enteral feeding within the first 24 to 48 hours, if tolerated. And this is extremely important. Alcohol avoidance, 0 alcohol. And a lot of individuals have a hard time understanding this. They have to completely discontinue the intake of alcoholic drinks. 0. Not even socially. Because if you already had some injuries to your pancreas, and if you continue to hit the pancreas, then you're going to develop more complications, possibly more complications later on. Now, how are you going to manage this if it is chronic? Well, number 1, I just said it, you have to avoid alcohol intake. This is extremely critical. You have to give some pancreatic enzymes, like supplements, for example, Creon or Sempep, to help with the pancreatic enzymes. This helps tremendously. Also, fat-soluble vitamins supplementation, such as vitamin A, vitamin D, vitamin E, and vitamin K. Pain management is important at the beginning, but you have to titrate the pain medication. You have to eventually titrate it down and use use the least amount as possible. Now, everything in life has risk, benefit, and alternatives. And some of the risk or complications of pancreatitis or acute pancreatitis includes pancreatic pseudocyst, pancreatic necrosis, pancreatic infection, hypocalcemia, progression to chronic pancreatitis, which I mentioned in the past, increased risk of pancreatic cancer. Yep, pancreatic cancer. So, in conclusion, alcohol-induced pancreatitis is due to the intake of alcohol. It is extremely important to avoid alcoholic drinks when you have acute or chronic pancreatitis. Pancreatitis is due to the persistent injury to the pancreas due to the intake of alcoholic drinks. Therefore, the best thing you can do to avoid acute pancreatitis or alcohol-induced pancreatitis is to completely discontinue the intake of alcoholic drinks. If you found this video helpful, then don't forget to follow Gastroenterology Simplified for clear and simple medical education. By the way, this is completely free. All right, don't forget to click like, subscribe, and I will see you in the next one. Bye.